Welcome to Reducing Healthcare Costs, Tools, Strategies, and Patient Assistance. This is a part of a series of health access, advocacy, and policy webinars put on by the Hemophilia Council of California. Today, our presenters, Mandy Herbert from Patient Services Incorporated and Kim Eisenberg from the Hemophilia Federation of America, will be going over different tools and strategies that you can use to reduce your healthcare costs and considerations and programs that may change in 2020 and beyond so that you can figure out the best strategy for paying for your care.
Hi, everyone. Thanks, HCC, for asking me to be part of today's webinar. Again, I'm Kim Eisenberg, and I'm part of the policy and advocacy team at HFA. I'm hopeful that I know most of you on the phone, but if I don't, just wanted to give that little bit of background about me. So here's what I'm going to cover today. I'm going to quickly look at some trends impacting cost in healthcare insurance, at patient assistance that's available, an overview about patient assistance, and then resources that are available. First of all, I want to look at these trends in insurance, and a lot of it is really for the insurance company to find ways to cut costs, not to cut our costs. So, of course, we've started to move more into the area of formularies and preferred drug lists. I'd say back in about 2010 to 2013 is where we really saw these starting to grow. So again, about the same time that the Affordable Care Act came online. We have been working hard in a number of states on step therapy bills and putting in what we call guardrails so that your physician can work with your insurance plan to give you an exclusion of the step therapy and then have the drug that he or she writes. And also we see an increase in specialty tiers over the last few years. And that just means instead of a steady copay of like $25, a specialty tier would run into the co-insurance area of up to, some have them as high as 50%, but typically 15 to 20% are numbers that you see. Prior authorization, I'm sure you're all familiar with this. It just it requires certain products, and a lot of times it's also part of a preferred drug list. Certain products have to be authorized before they are dispensed to you. We have narrowing networks of providers. So if perhaps your lab is not in your insurance plan, perhaps some of us ran into hemophilia treatment centers not being part of the plans when the Affordable Care Act passed. And we know, of course, in California, there is just the issue that you have with Kaiser. So with those narrow networks, we're finding people have more and more issues with surprise billing because they were served by someone who didn't, some provider along the way in their care that was not in their network. You hear a lot about legislation going on both at the state and federal level on surprise billing bills right now. As we all know, when the Affordable Care Act passed, one of the discussions was in order to include everybody into health insurance and not be denied because of pre-existing conditions, the patient, the families themselves had to take on more of the cost of care. So we have rising premiums, rising deductibles, rising copays. I'll talk a little bit more about that in a future slide. Because of the Affordable Care Act, the payment of healthcare party premiums has become an issue of some controversy. And so the Affordable Care Act made some, because of the Affordable Care Act, Health and Human Services put forth some regulations that that put some health plans in the position that they can reject third-party premiums. If you have any specific questions about that, I think when we get to the question and answer part, both Mandy and I are available to answer those. And then shorter enrollment periods for the marketplace. So every year they've narrowed, and there are a lot less assisters to help you figure out your way through the marketplace plans. And finally, I'll talk some more about accumulator adjuster programs, and only at the high level because you will be having another webinar coming up in the near future. So just quickly, some basic terms. Premium, that's the monthly amount you pay for your health insurance. Typically, if you get your insurance through your employer, they pay a large part of the cost of your care, but you will have a premium that is typically the paycheck. so you don't have to send in a check every month. Deductible is the amount you must pay before your health plan kicks in. Deductibles, when I first started having to worry about paying my own deductible, they were $100, $200 per person, and now I'll go over the numbers you'll see shortly, but it's a much larger number as we talked about increased costs of out-of-pocket costs. Copay is the fixed dollar amount you pay for services and or prescription drugs. Typically a generic or maybe even a tier 1 is in the copay. So it's a set number, like a $15, $25, $50. But then we move into co-insurance, which is a percentage. So those are usually for specialty pharmacy drugs. They're usually higher cost drugs. So the patient, the family is bearing a much higher percentage of the cost. So what are some of the financial resources that are available to you for helping to pay the cost? Well, over here on the left-hand column, you will see health spending accounts. And these are accounts that are provided through your employer-based plans or your private plans. And there are 3 different kinds: the health savings account, the health reimbursement account, and the flexible spending account. Basically, what they all have in common is this money is deposited, again, usually through payroll deduction prior to tax, to your salary being taxed. So it's taken out tax-free, it's tax deductible, and it's used only to pay for your medical expenses. And then what makes them different is how they work. And your employer determines that. And if you have some specific questions, when we get to the question and answer period, I can answer that. When you get to open enrollment, it's one of the things you'll want to look into is what does your employer provide for you that's tax deductible that you can then apply to your health insurance expenses. So you get a little bit more money there because it's your income that wasn't taxed. And then on other resources, copay and co-insurance assistance, typically they're provided for from the manufacturer of the product you take. We'll talk again a little bit about accumulator adjuster programs and how that's impacting the copay assistance that you are able to get from your manufacturers, and premium assistance. And we had Mandy talk about PSI's premium assistance that's available. And I'll talk in another slide a little bit more about other kinds of premium assistance as well. Out-of-pocket spending limits. So the Affordable Care Act sets those annual out-of-pocket costs. And of course, every year with the expected increase of CPI and people's income, the amount has gone up. I believe it was right around $6,000 when it first started, and now for 2020, the annual out-of-pocket maximum for marketplace plans, and typically there are a lot of plans that employers provide that can reach up to this amount, so you have to watch for that, is $8,200, and for families is $16,400. And then what counts toward that out-of-pocket max are those items that we talked about earlier: your deductible, your co-payment, your co-insurance, and all qualified expenses for essential health benefit. Now, why did I point that out? Because there are things that do not count towards your out-of-pocket maximum. Your premium doesn't count towards your out-of-pocket maximum. Anyone who is outside of network does not count towards your out-of-pocket maximum, which is why it's critically important. It's really important for you to know who's in your network and who's not. And again, we are seeing a lot of discussion in the media by policymakers on surprise billing, and we want to make sure we do everything. Policymakers are working hard to make sure they're doing what they can to keep surprise billing from happening to you, because typically it's not your fault when you go to a non-network provider. And finally, if any spending on non-essential health benefits would not count towards your out-of-pocket maximum. So non-essential health benefits are often like your chiropractor. It depends on your health plan, but your chiropractor, your some perhaps holistic medicine, a lot of times those may not go towards your out-of-pocket maximum. So we just always want to caution you when you're looking at what's being offered to you. Typically, most employers, and then if you're going to the marketplace, you have a lot more options. in your plans. Make sure you're considering what your out-of-pocket spending will be, but also know that sometimes the lowest premium is not the one that makes the most financial sense for you. Both NHF and HFA have tools that are available on their website. There's worksheets so you can do that comparison, and I encourage you to use those tools. And if you are buying insurance on the individual market, make sure you understand that you are entitled to tax credits to help you pay your premium. The tax credit is really brings down the price of your premium. It's not a tax credit that you get later when you file your taxes. And are you entitled to assistance with your out-of-pocket spending? That's cost sharing reduction. You're entitled to tax credits up to 400% of poverty, and you're entitled to assistance in certain marketplace plans for up to 250,000% of federal poverty level. Now I'm going to talk about the awful accumulator adjuster program. And I think there are many people who are familiar with this now because NHF and HFA have worked really hard to educate the bleeding disorders community about these programs. What happens is when your manufacturer has a patient assistance program to help you pay your co-pays, the plan takes that copay assistance and does not count it towards your deductible. And so once that copay assistance is used up to that $12,000 that most manufacturers' plans are, your accumulator adjuster gets set back at zero. So basically, they took the $12,000 and now they're saying to you, your out-of-pocket max is $6,000. Your out-of-pocket max for your family is $16,000. So you have to pay that. This is a problem. We've done a good job of educating policymakers and regulators on this, and they agreed that the idea was to drive patients to generics, but we were able to help educate the policymakers and regulators to understand for certain rare diseases like hemophilia and von Willebrand disease and other rare blood disorders, there are not generics. All products are biologics. So this year, for the notice of benefit and payment parameters for 2020, a rule was originally put in place that said when there are no generics, a health plan cannot use an accumulator adjuster program. Unfortunately, as Robin said, they had to walk that back because some of the high deductible plans have tax implications, IRS implications, and so this rule does not follow IRS rules. We have been working hard with a lot of other patient advocacy organizations to figure out if there's a way to get high deductible plans removed from or add extra detail in the benefit of payment parameters regulations so that we can get back to accumulator adjuster programs not applying where there are no biologics. We don't know if that's possible before 2021, so we'll continue to work at the state level to pass bills that ban accumulator adjuster programs. So unfortunately, that news isn't good. Stay tuned. We continue to work on this because we know it's a problem for so many people. And whenever you run into problems with your insurance, please be sure to reach out to Project Calls at HFA. We know when you're in the middle of a denial or an access issue, we don't expect to hear from you because you're dealing with it. But once that you've moved through it, anytime within a year, we would love to hear from you. Share your access issues. I'll talk a little bit in a minute about why that's important. Here are some of the resources that are available to you in this slide. These slides will be available to you so you can go back to them. There are 37 states with state assistance programs. And when I say that every state program is different, it might apply to hemophilia, it might not. As many of you are aware, in California, you have the GHPP and CCS programs to help meet your out-of-pocket costs. And I'm happy to answer any questions, or I'm sure that Robin could probably do a better job of that than me about those two programs. GHPP and CCS. And then you always want to work with your HR department. They may not know that this accumulator adjuster program is impacting you, and they may not know how it's impacting the cost of your care. At NHF last week, and Colette Koulianos, who works specifically on an accumulator adjuster issue, told a case story of a patient who was a moderate, I believe, who was typically, the cost of his care was typically around $38,000 a year. And unfortunately, because of a denial or an accumulator adjuster program, slowed down his care, and he ended up in the ER, and he was much more expensive to that insurance plan than they had previously, up to the tune of, I understand, $3 million. There are other resources available to you on both NHF and HFA's websites. We are working, NHF, HFA are working with national organizations to continue to educate the state insurance commissioners, and we have sent 2 letters at this point in time. Again, I mentioned that there's a lot of state legislation going on in step therapy, in out-of-pocket costs, in accumulator adjuster programs, in how assistance programs might apply to bleeding disorders. And finally, as I mentioned, we have project calls. So why is project calls important? We are able to accumulate this data when we hear from you, when you've had an access issue, and we can use this information when we go to meet with policymakers to help them understand that because your copay assistance didn't count towards your overall deductible, you may have delayed care. And by delaying care, not only are you likely to have negative health outcomes and consequences of a bleed, you could end up in the ER, as I mentioned about the young man I discussed earlier, and the cost of care goes up much higher, and therefore the whole idea by these cost containment measures, whether it's step therapy, whether it's accumulator adjuster, really indirectly is the opposite of helping the health insurance plan control costs.
Thank you so much for joining us. And just as a reminder, this webinar is part of a series of educational presentations by the Hemophilia Council of California and all of our wonderful volunteer presenters who carve out time out of their days to help us. And thank you again to our 2019 series sponsors, Takeda and Sanofi Genzyme. Thank you so much for joining us today.